Sir, there is a full system of doing that. There is a secretary of registration of societies in
Yes,
the
sir.
secretariat of the place. You have to first get the name approved. Then you have to write a constitution, get it signed from few people, and then give it to them. They will first say that no, you cannot keep this name or that name which is earlier registered, and then it happens. It takes a month or two.
Yes, sir.
You can talk to a lawyer.
Yeah, we are in talks.
To begin with, you can collect some funds so that those things can be funded from all the members. We can contribute amounts so that you can run that show, because it takes some money and some effort to do that.
Yes.
I registered a society here in Panipat for Panipat psychiatrists because we had to conduct a conference, and the companies would sponsor only through the society. So I made a society with few people. So there was a lot of running around.
Yes. So that's what we, so the background work is done. So the Academy of Cannabinoids as such is not registered with anybody. So we have a really good thing. So the background work is done. And once it is up, then I think I'll...
You have to write a constitution, get it signed from a lot of people, and then you have to give them. Then they will give you the registration number. Then you can open an account and apply for a PAN card.
Yes.
Which is required to run a society.
Yeah. So that's what
then you can get the account certificate and all that.
As far as constitution is concerned, I think I'm just going to copy paste the constitution of Society of Cannabis Clinician because it's simple.
Yeah, you can do that. You can do that. You can do that.
And I've already taken.
But you have to get it signed from few people who are around you, so that there is a secretary, there is a president, and there is a treasurer, and those things are there. At least to show them.
Yes.
Okay. You guys want to have your lunch now? No,
No, we had lunch. Thank you, Dr. Smriti.
If you want to come to meet her to talk about your hair.
Yes,
Yeah.
because when you're there.
You want to eat something?
Please kindly love to invite us for the lunch. Okay. So we have done the running around, sir. So we thank you for the inputs. So then we can go ahead. And once the input and this thing is done, then we can move ahead and I'll present it to you. And then I think, so we are hoping that by the year end, we can form it in a big way and then present it to, I think, the government, because the government is asking.
We can have then we can call for an annual conference somewhere.
Yes, sir. Yes, definitely.
First conference I can do in Himachal, in any place you would like.
Thank you, sir. Thank you, sir. I think
I will arrange.
We will do that depending on what is available. We'll definitely. Thank you, sir, for giving us this heads up. So, any other people have any ideas? क्या आप लोग सब सिर्फ सुन के हाँ करते रहोगे? But even I think whether it is Dr. Ketiki or Dr. Hyderabad Patil, Dr. Smriti, Mona Doctor, there I think they're in tune. Even Dr. Surya Ramesh and all. So we just I just gave you heads up on that. And second part is the academic part which is we are doing, and third part is conducting this conference, and that also will finalize and do it. And we have a good team here of some of the enthusiastic people. They are ready to pitch it in. And any questions on the base of your clinical use of cannabinoids?
Anything that we can do to contribute and help you in this work?
No, that I'll ask you. Definitely, I'm not going to go all alone. I'll definitely ask, but I'm just giving you heads up so that it is very early September. Then we have October, November, and then I think we were planning to put it up by end of, because the Canazo India people, they are preparing for marriage. So I don't want to spoil their festive mood right? So their marriage, once it is over,
Yeah.
then I think we can go all up with this.
Hmm.
So academic parts. So I have shared you the another thing about cholangiocarcinoma, which came to me in May. So this patient's Anil Kumar Chanda. I should have not taken. So his son had approached me. He is in US and he knows that it can help. So he was looking for RSO. This is very bad pretext that we keep seeing, that people, they come to us looking for RSO oil, and we should not say no, we don't have it. No, we have it. All the extracts that we have, they are RSO oils, or they're rather better than RSO oils. And in the pretext of RSO, the oils that are being sold in India are laden with alcohol. So we should take it up and use it. That's what I have been doing. So, and the results are in front of you. And second was another case of colorectal cancer. Uh, so I did very minimal investigation because they had done colonoscopy and they found that there is cancer. And we said, let us start it. And we just did the objective testing like CEA and CRP, which was high. And then after 3 months, we came down. And along with Dr. Ketaki, we have 2 more people who are doing very well with the support of CBD oil. So there are always questions like people ask me, can we go all alone with CBD? The answer should be no. Why is because we get people who are okay with it, but then we should be sure that the failure should not come drastically. That is what I have seen. I have seen people drastically going in bad and worse because of this COVID vaccinations and all that support. So that's why we should tell that let's try and let's do this. And second thing is, I have had people, doctors approaching me who are shy to do the course and all, and they did. So there was a discussion going on P53, and we did it well. They understood what exactly it is. So I'm just proposing some small things today. So when you get a cancer case, first thing is not to get scared. Look into the reports, whether they have done some minimum investigations so that they have identified their disease. So if somebody says tongue cancer, whether it is squamous cell carcinoma, whether it is keratinizing, non-keratinizing, just example, or any cell type, at least we should know. Like for example, bladder cancer, I have 2 cases, both are not responding to CBD oil because it is transitional cell cancer that doesn't respond to any other cancer. Then we have germ cell cancer, which responds fantastic to CBD oil. I have 2 cases, and both the cases responded very, very, very. It's just shocking. Like an oncologist said, it's shocking to see you getting well. So we do all the parts that we have to do. So the moment you should see whether minimum investigations are done. If not done, you should go through the investigations and ask them to do, CBC, CRP, some cancer markers, and get those tests so that we are prepared in case if the case goes other way, we know that what we are doing is right or wrong. Okay. And compared to neuro cases, so there were some junior doctors were telling कि sir उतना result नहीं मिल in the neuro cases. The thing is that neurodegenerative cases, by the time the symptoms come out, it is already in 2nd to 3rd stage. And sometimes if the repairability is not there, then what do we do? So like for example, Parkinson cases. So I have told you that we have to divide these cases into 3 equal things, whether the endocannabinoid system is weak or whether it is normal or whether it is hyper. Because we should understand that though they may be having neurodegenerative disorders, but the endocannabinoid system could be in hyper mode. Like Dr. Ankur was telling the other day that he's getting very good results with high doses of CBD oil. That is because if the endocannabinoid system is in hyper active mode, we need to use only and only CBD. and sometimes very high doses of CBD, like 200 milligrams of CBD, and then we get very, very good results. But in people who are just initiated, maybe the MRI doesn't show such a bad thing. We can start with the 1:1, like the core or the full spectrum things, and then we should build up slowly. And also don't forget about using certain additives. When I'm saying additives, means we should understand that the antioxidants play a big role. Like, for example, in Parkinson's, this is the role of N-acetylcysteine and glutathione should not be forgotten, because they really do a lot. And also, if there is, I had a very interesting case in Bangalore, the first case when we started here in January. So this guy had heavy metal lead poisoning. So the lead levels were very, very high. And what actually happened is we had given glutathione in advance. So what glutathione does is it shakes up and releases the heavy metals into the blood. So the heavy metals were looking like 300, rather the normal is within 150 range. And we started the chelation therapy, no response. So the people will say that, after 30 cycles, there is no response. But the response is that the patient has not gone bad. And then it took me just 1 week back, just imagine, so almost 8 months. Now, 1 week back, he's telling, yes, I'm seeing that he's much more into, like he's trying to sign the papers now and all those things. So that's why we should understand that the heavy metal poisoning, if it is there, we need to rule out. Then we need to use the antioxidants like NAC, glutathione, even resveratrol, curcumin, because they really do a lot better. So the question is about the curcumin brands. There are many things, rumors that is going on. Sometimes they say that curcumin will not be absorbed. Sometimes they say it is absorbed. So I have seen one particular brand, not to tell this, but that I have always seen that says stayed the test time, and that is NEC 30 by
Snake 30, sir.
Snake 30.
Snake 30.
Yeah. So this Snake 30 is curcumin, and the active curcuminoid is only 30 milligrams. So you don't get side effects like loose motions or rashes or any other issues. That is one. And thanks to Dr. Chitranshu, who actually told me about this long back when he was new, sir. I've tried in one case and I've seen that it works. Then I contacted them and asked for the papers, and they discussed with me the patent technology, and I think it is really doing well. But apart from this, any other curcumin brand is also fine. The another one that I have seen, especially post COVID, that I have been using is Thymocumin. So it's a brand. It's a combination of black seed oil with curcumin. BD doses, they really do well. In the integrity group, we were talking about this as to use for vaccine injuries and all. So that is another very good. And now there is one theory that is going around, and that is the theory of type 3 diabetes, maybe. Yes, type 3 diabetes, which they say. So when we look at the type 3 diabetes theory of dementia or Alzheimer's disease, that's when we have to use anti-insulin preparation. And the best anti-insulin preparation is berberine, myoinositol, MCT. I have posted on social media post, and curcumin. So if we have that, if you see that the patient has been diabetic for a long time, then you have to address that. Whether it is working or not, we really don't know. But what I have seen is that after some time, like 4 or 5 months, that they really improve. So also we discuss about old age, healthy aging. So in old age also, there are many people who are coming up and asking, sir, can I take one drop? I said, yes, you can take one drop or two drops and keep taking. But then the same person calls after 30 days, sir, kuch hua hi nahi. So what do we see? How do we show that, prove that it anti-aging? I said, up you look at the parameters after 3 months or 6 months. And I have had people of rheumatoid arthritis since last 2 years. I asked them, how is your liver? Fine. How is your skin quality? And this is surprisingly fine. I said, look at the other rheumatoid patient who has been on a methotrexate or HCQ combination. Their skin keeps becoming dark. But look at your skin. It's glowing. We had a case yesterday and I was actually showing comparatively. That's when she had a trust. Because she's saying 6 months, I've been taking CBD oil and the effect is only 30%. I said, still it is good. And that's what we need to understand in autoimmune disorders. Okay. So any questions based on therapies? So I really don't know because I'm just say the moment I'm training, I'm seeing more of cancer cases here in Bangalore. So I'm getting very less of neuro cases, very less of autoimmune cases. And thanks to some of the oncologists here in Bangalore, that they have agreed to, like yesterday also one new oncologist I met, and he's telling, yeah, I'll give heads up. So it is a case of colorectal cancer, which is very aggressive cancer. So I asked him, what is the chances after you have given chemo? So I don't know. So, but I can say that you give 3 sessions of FOLFIRINOX, and I'm sure he'll be out. And she's saying, how do you know that we give FOLFIRINOX? I said, that's the medicine of choice for colorectal cancer. 5 of you. And he said, yeah, it is really. So that's why we use it. So, and also you can, just a little self-exaltation on my part is that they accepted my membership in Association of Clinical Oncology. I've been trying it for last 2 years to get a membership from Association of Clinical Oncology, but they were hell-bent upon telling that they'll take only oncologists. You have to be attached to the thing. And when I joined this hospital, I had submitted that. And now they send me a message that we can relook at your application if you look. So I joined, and luckily, so I got 1+3 offer. So I took 3 years offer. So now I hope to get much more exposure with clinical oncology because that association is doing really something. So we keep doing our parts, and I'm so happy that you have been in like a team to us, and we shall really go ahead. And another aspect, I think, I don't know how many of you people are understanding the mind-body aspect. Are you able to do? Because we don't know how much people agree to it. Like if you say yoga, they say, yoga. No, it's a code karega yoga. Bemaron ke liye nahi hai. So that's what you have to change. So you put it in like aerobic exercises or stretching exercises. Then they say, wo karenge, correct. And same thing when you tell pranayama, I said, wo bemar logon ke liye nahi hai. It's not for diseased people. It is for healthy people. And in the same thing, you put that is breathing exercise. You breathe in this fashion, that fashion, and they agree to it. So we have been exploring it a lot. And I've seen that if we can combine that mind body and do it, it is really doing very well. I know Dr. Mona is doing that part very well. But other people, I don't know how much you people are doing. But we should understand that this part is really important. And my consultation, after 10 minutes of my consultation, I always ask about the psychological issues that I see on the face. I ask them, why your eyes drooping like this? Why your smile is crooked like this? And they have never seen it. But it is not crooked. It's just that expression. Okay. So that mind body we should do. I'm waiting for Ranika to be little free so that she can take us a lecture on mind body, and then we can go ahead. And in Bangalore, this trend is very acceptable in the society here in Bangalore. So we are doing the breathing workshops, and we are seeing good results. So the first time, I think, Dr. Mona, how many of you know something called as holotropic breathing? Holotropic quick breath work. How many of you know a guy by name Stanislav Grof? Dr. Ankur, have you heard his name? Stanislav Grof?
No. Holotrophic breath work, I have just heard once. Somebody in India does it, but not in detail. Not learned really what exactly it is.
So this is something we should. So next time when it is in Bombay, Dr. Ketigi should attend. At Dr. Mona Center, they had conducted, and it was really very good. People who attended,
Oh,
they
sir,
really,
do let us know.
yeah.
May I say something, Dr.
Yes,
Tahir?
please. Yes, please.
Yes. Better than the holotropic breath work, there is this organization in Bangalore. I think someone called Mahesh runs. It's called the 5-Element Breath Work or Sadgame Foundation. And I recommend that every human being should do at least 3 sessions. Everyone, regardless of anything. And of course, if there is deep trauma, then yes, you need more. But it is more than surgery, what happens in those breathwork sessions. Basically, within 10-15 minutes, you go through, it's called continuous connected breathing or circular breathing. And once one starts this, within 10 to 15 minutes, you experience something called ego death. And that's when the body starts healing. It's amazing. And I recommend that everyone should have at least 3 sessions to clear whatever stuck energies. And it literally goes from the cellular memory, because it's all trapped within the cells. So even things that one is unconscious of or doesn't know that trauma exists, whether it's a birth trauma or childhood trauma or whatever life circumstances. Most of my counseling patients, I ask them to do 3 sessions, and then they don't need me anymore, and I'm the happiest because the work is done just by the breath. So it's incredible. Thank you, Dr. Thari.
Yeah, thank you.
Dr.
Yeah.
Mohan, are you talking about Bangalore, Meena Iyer?
No,
I had-
she does holotropic breath work.
Yeah.
Which was started by Stanislav Grof.
Okay.
But this 5-element breath work, in holotropic breath work, what's happened is there's a sitter and a breather, and both are novices, right? So it may not be as intense. Whereas in this one-on-one sessions, when you do it with Sadgame Foundation, we do it at my center in Bombay. You are breathing with someone, and someone is taking you through that, and wherever the energies are stuck in the body, she taps and moves it. And it is, I mean, everyone should have at least 1 session to actually experience what it is. And things that years and years of trauma can just get released in that 1 session. It's just absolutely incredible. So it is, what psychedelics can do, it does that. You do it through breath. That's what actually Stanislav Grof found out, that the same effect that psychedelics can do, you can do it just by breathing. And it's immense.
Definitely.
Yeah, in fact, right now in my center, there's a session going on. So, yeah. So, yeah.
That's very nice. So this is something to do with breath work. And another aspect is, if you're not comfortable with breath work, then always, I think we are trying for that to induce a psychedelic thing. Dr. Ankur, any insights on psychedelic? Dr. Ankur, so I want to hear if he knows anything. We have been talking and doing a lot of things, and we're trying to connect with things. Yes, Dr. Ankur.
Yes, sir.
Psychedelic.
Psychedelics, as such, I have never used.
Hmm.
But now there is a new antidepressant, buprenorphine, bupropion with dextromethorphan, which I am using in some patients of depression.
Hmm.
And ketamine sometimes I have used for suicidal patients.
Mhm.
I have
Yes.
never used mushrooms, etc.
Ah.
Only these two things I have used.
Even
Give good
ketamine sessions also, because ketamine also takes us into that psychedelic space.
Yeah.
So there can be a lot of releases and yeah. So we are actually doing a study on treatment-resistant depression and ketamine and its effectivity in Bangalore. So it is done by another psychiatrist that I know, and he has taken. So in our hospital, at the Arca Hospital, we have done more than 25 sessions so far, and we have seen that it's really good. And personally, we are also exploring these things in a deeper way, Dr. Ankur. Maybe जब मिल बैठेंगे तो यार we'll talk a lot about.
Yeah. But the main thing is that the indication with me is suicidal patient only.
हाँ. Okay.
छोटे मोटे depression में नहीं.
Never. Because then it doesn't add up to the values. So this is like a prime thing, psychedelic. So we should not waste it on small issues. Yes. So that is so how many of you know something called as Kutastha Chaitanya? It's a Sanskrit word. So I can say that people who have read that book, Autobiography of a Yogi, they will know what is Kutastha Chaitanya. Enhanced awareness, or so called as Krishna consciousness, or Shiva consciousness, or Christ consciousness, whatever you want to put it in that. So this has been well described in Vedas, and the way to get it is like Kriya Pranayama, as Babaji's people and Yoganandaji's, they have kept doing that. So we, in our literature, it is just a natural, whether it is Indian, Chinese, or ancient literature. So we have been using this through the breath work, the control breathing, as we call it, and then it has enhanced. And adding different modalities to it can really enhance, like Dr. Mona was actually telling, what 5 elements. I've never met Mr. Mahesh, but I think maybe we can meet once, because he's very close to a place where we are conducting a sort of workshop this time. So very close to his place. So I'll try to meet him up. But this is the different breath works that can also add up to the healing things of the medical things. Like Stanislaw Grof is a regular psychiatrist who has worked a lot on psychedelics. And then when psychedelics were banned, he had no other ways. So he came down east and he learned about breathing. And then he said, it is too complicated. Let's simplify it. And he simplified it into the holotropic. Holotropic is just a simple, it is nothing, no big thing. It is just that you breathe and keep breathing voluntarily, rather putting like hyperventilating yourself till you hit the pot. So you keep hyperventilating till you hit the pot. So that is what it means. And once you hit that spot, then you get what you have to. Sorry, my mistake. So many things got posted. So that is what. So when we hyperventilate, something happens in the DUE thing where the psychedelic pathway actually gets enhanced, and that actually creates the sort of release, you know. So, but it's not like everybody, it works in the same way. Some people, they may like, some people I've met some people who said it was waste of the time. And again, it depends on the Dr. Mona said, a sitter, whether the sitter is able to bring it out what it has to. So the workshop that we had in Bangalore was really interesting because Ranika, we had already briefed the people on, especially Ranika, I would say, that we had briefed the people what they have to expect. And when you put that in the subconscious and then you go into it, then I think it's better. And same thing with that 5 elements breath work that Dr. Mona said, that he sits with you and he helps you release it. Yes, even holotropic breath work is also done 1:1. So, and they have so much work. It is not just simple breathing. They have so much work into that. And all these things we should understand and we can utilize it in our practice, because a time will grow when without the knowledge of this mind body healing, you will not be able to deal with. After coming to people, Dr. Haridwar Patel, Dr. Ketki and Smriti, because they are basically homeopaths, so they understand what is the relationship of mind rubrics, as we call it, the mind rubrics. But I used to always neglect, because I have never seen patients expressing their mind so much when I was practicing in Kerala. So from 2000 to 2022, I have seen so many patients. I used to take only the physical genders, the physical symptoms and give, and I've got fantastic results. And it is not like I was not open to the mind symptoms, but here when I came and the guys say, like for example, this young lady came and she has so much, and she has taken, she had become, first time when I met her, she was, I think, 52 kgs. And the last time when I met her, where I saw that I have to put her on homeopathy, is she has become 38 kgs. And she has got this I forgot the name. It's funny. I've never heard it in my studies. So it is like anti-gastrin antibodies. Sorry, anti-gastrin antibodies. So her stomach is actually shrinking. The antibodies are against the gastrin producing cells, and the gastrin is actually decreasing. So but she doesn't have any much symptoms other than losing weight and losing her appetite. And I've been seeing her since last 4 to 5 months, but I never touched her. I said, no, you are taking treatment from one doctor, I'm not going to touch. So this time when I saw, she kept losing on the weight. So, and then she said one thing, doc, kuch to karo yaar. If I can't even taste milk, how is it possible? If I taste milk, I just go crazy. Kya karu main? Mujhe batao. And I was like, oh, okay. So are you ready to take my treatment? He's saying, kuch bhi treatment kaam nahi kara. Ab to I'll try your treatment. I don't have any issue. So, but she said, no cannabis. I said, okay, bhai, no cannabis, come. I took her case, and some of the symptoms that actually related to this is the symptoms that Iodium has very profound. And I was literally shocked that even the physical symptoms which she has, she's eating well, but kept on losing weight, but there is no thyroid issue at all. And that's when I identified, I gave her Iodium. And today morning, she gave me a call. I think it was just last week. And today morning, she gave me a call. And she's saying, I'm eating so much, doc, what I should do? I said, are you following the diet? She said, yes, I'm following that. And then no issues. I said, you go on eating, I don't have any issues. And from the day, I always use high potency for your information. So I'd given her Iodium CM shot. And what actually transformed is really amazing. I'm going to see her tomorrow. But that is what. So the modern diseases are so much that the science of it is so complicated that we may not be able to even diagnose the disease. So in such ways, the mind is what actually creates it bad. Because she used to carry this many documents and go doctor to doctor telling, I have already done the research and this is the diagnosis. Which doctor will accept you? Tell me. So, and that's what actually is bad thing. But she's telling, I'm doing this because nobody is able to understand my problem. So that is what so mind body is really the need of the hour. Anything you want to say, Dr. Ketaki?
No, I'm just very happy listening to this because homeopathy does give us very surprisingly great results at time which cannot be scientifically, sometimes we are only shocked how such a lovely response. Even in kids, I have seen some kids having cetirizine every day, and just with the one dose of sulfur and a little sabadilla, very good response. I think their bodies also accept it faster.
But I think people who have known me from Facebook, the homeopathy doctors especially, they'll be shocked if I tell them, because since the time Facebook has started and sometimes we started. So I have this group on Facebook. I'm not active anymore there. So it is like clinical diagnosis and homeopathy. So that is the group. And in our group, there is Dr. Aparna Singh. Now she is in charge of that. So I am not looking after that group. So there I have presented more than 200 cases. With the moment patient comes, I used to take the history and post it. And I said, wait for the response and let's see what happens. And some of the very good, bigger names in homeopathy in Bombay, like Dr. Menon, whom I never had an occasion. I came to know about him only after he died. I never understood what amazing personality he was. And even there's Dr. Muhammad, who is a surgeon and who does. So he also. So they'll be surprised if I tell them that I'm using 9 rupees to get a remedy. They'll be actually surprised. But that is what it is needed. Yes. And same thing, backflower remedies. Yeah, they definitely work on the emotional pattern. But that is separate. But whether we use these remedies or not, we should understand the mind, and what exactly it is creating, the disease creation from the mind, and whether can the mind actually maintain the disease. So more specifically, we should look at mind not able to. Like I have cancer patients who came to me for the third recurrence. I just asked, why it is recurring for you again and again, and recurring at the same spot? Why not some other spot? I just joked with the lady and I said, "Arey, leave your husband. How long are you going to catch up with that cancer?" And she was shocked. It's like, how do you understand that? So it is just like, just a fun for it. But if you can handle that part, the mind body part, that can be really, really something. So please look into those aspects. And especially when we do CBD, cannabis, you have to understand the mind, because otherwise the fears can be very bad. I've had people who tell me that your cannabis is very horrible medicine because it excites the panic attacks. Then I ask what kind of panic attacks, where is it coming from? And then we release that and we address that issue, and then they can take the CBD oil much better. So that's why mind body healing is really important. Okay, I've talked a lot about what I have to do. I hope I will. I know, not I don't hope. I know that you will be there for the things. So any questions from your side? If I can help out, I'll see.
सर एक सवाल
जी सर,
सर एक क्वेश्चन
बोलिए सर।
सर ये इतना गंदा टेस्ट है इसका, मैं कोर लेने की कोशिश कर रहा था, इतना कड़वा है सर, कैसे खाना है?
तो आप you can mix it in something. आप जो है थोड़ा घी में you can mix it in ghee or in butter and have to, because we have terpenes in that. So the terpenes give that horrible taste and it stimulates the trip receptors. So sometimes you feel bitter, sometimes you feel.
ऐसा लगता है जैसे कोई स्ट्रॉन्ग कॉफी का टेस्ट है वो।
हाँ, it is because of beta carotene. So that is there. So the full spectrum will have. अभी आप CBD oil लोगे तो उसमें तो कुछ भी नहीं होगा. So you'll just feel like you're drinking water. So it doesn't help.
इसको कुछ गर्म पानी में डाल के लूं क्या?
गर्म पानी में आप ऑयल को कैसे डालोगे सर?
नहीं, पर घी तो आई कैन नॉट टॉलरेट, घी तो मुझे बिल्कुल गंदा लगता है।
Okay, then you can use avocado or you can use, so these are the innovative ideas which I got from parents. So they say that they take a piece of banana, cut open करके उसमें आप oil डालो और खा लो. So it gives the same effect.
ऐसा ही करना पड़ेगा।
हाँ, you can do that.
मैं तो थोड़े दिन में भाग गया, मैंने कहा भैया ये तो बहुत कड़वा है।
Yes sir. Especially जब 5 ड्रॉप 10 ड्रॉप लेने पड़ते हैं तो it becomes very bitter. That is because of terpene. Terpene they excite the taste buds, so that's why you get different tastes.
Sir, I had one question. When we start, when I have started for one or two people I saw, Vijay Amrut, in the night. So initially they are okay. When they have reached 8 drops, no, they say suddenly the sleep, which was in good sleep, has suddenly then become disturbed. So they wake up, if they're going to sleep at 11, they suddenly wake up at 1:30 and they're awake for 1 or 2 hours. Does this happen with
How long they have taken, that is important.
just around? See, I started with 2 drops, then gone to 4 drops. So over 1.5 months only they have taken, and they have reached 1.5 to 2 months. They have reached 8 drops, but then they start feeling.
So this happens because of tolerance. So their tolerance is very high. Sorry, their tolerance is very low. So
Okay.
that's why they're not able to. So then this what it is happens because of the THC element in Amrit. So then what you can do, you have to stop for 3 days and go to doses which they were comfortable. For example, if they were comfortable with 6 drops, you can go back to 5 drops.
Okay, okay.
So that is
Okay.
very
So
common, especially with
that is the
sleep.
limit. Basically, that is the limit that they can take for their body.
Yes,
Is
yes,
what is to be
exactly.
understood.
Exactly.
Okay.
Exactly. So any other questions?
Also,
We
sir,
wrap-
if in such cases, can we give them in the day, like Vijay Amrut, the 4:1?
No, it is, see, the thing is you can give it in the daytime if they are not actually able to sleep with it. You can give in the daytime.
So maybe they can tolerate, and if that doesn't affect the sleep in the night, then good enough, no? I
Yeah.
can do.
Yes,
Okay.
no problem.
थैंक यू डॉक्टर ताहिर, आप SOS हेल्प कर देते हो फटाफट, और कोई क्वेश्चन पूछो फटाफट आप जवाब दे देते हो. थैंक यू.
Yes, thank you, sir. Thank you, sir. So I'll see you again maybe after a month. I hope to. So आपको पूरा वो ढांचा बना के I'll create the whole thing and get back to you. And with the finances, I'll let you know कैसे होगा. So we'll work on sharing basis.
हाँ हाँ. और आप वो डालते रहा करो, केसेस डालते रहा करो, सक्सेसफुल केसेस ना, that encourages a lot.
Definitely.
Thank you, sir. Thank you.
Thank you.
Okay. Take care.